Hi, welcome to Neat Oral Pathology Sessions. Here we are going to start with a new chapter, that is our fungal infections of oral cavity. Okay, fungal infections of oral cavity. What questions they can ask from this fungal infections of oral cavity? Your NEET competitive examinations mostly focus on the candida and its associated lesion. That's a very important topic. Okay, candida is a far repeatedly asked question in any of your competitive examinations. So you should be thorough about the candida. That's a focus area, main focus area. What else they can ask you is that they can ask you little about the mucor and aspergillosis. What is the criteria to differentiate between mucor, as due to this COVID condition, the black fungus has gained popularity. Okay, so they can ask you something about the mucor and aspergillosis and mostly about the candida. But still, we will discuss a little about your fungal infections of oral cavity. Now let's see what's there in the fungal infection. To start with the fungal infection, we will start with the classical presentation of certain fungus. Okay, how they appear in the oral cavity. We'll start with our blastomycosis. Now blastomycosis is a fungal infection. There are two type of blastomycosis. uh, they are both are foreigners. There is north american blastomycosis and your south american blastomycosis. Yeah. So North American blastomycosis, South American blastomycosis. North American is caused by your fungus, that is Blastomycosis dermatitis. Okay, dermatitis. And your South American blastomycosis, that is caused by your para cookie idodiomycosis. Okay, so these are the two organisms or two fungal organisms: Blastomycosis dermatitis, that makes your North American, and Paracoccidiomycosis that makes your South American mycosis. And see, the manifestations are usually similar here. Both are present in your skin and your oral mucosa, and they make this infection. They start as an ulcer. They make pustules, ulcers, and they erode the area. They can also involve your oral cavity also. The main difference, the main question area which they can ask you is that mainly the feature of the organism, how the organism look like. Okay, the organism which has a double capsule. So here, what happens in North American blastomycosis, we have a double capsule. Okay, or we say double refractive cell wall, double refractile cell wall is seen in your North American blastomycosis or your dermatitis. While in the South American blastomycosis, how they see is that there is a budding of this fungus that, in a fashion like Mickey Mouse ears. Mickey Mouse ear like budding. Okay, means that the daughter cells are attached to the daughter cells. The daughter cells are attached to the parent cell. Okay, and they are looking like a Mickey Mouse ears. Okay, so there is other term called, if the daughter cells are attached around it, it is called a steering wheel or mariner wheel appearance. Okay, so there is multiple daughter cell like appearance in your South American blastomycosis, and your North American blastomycosis have a double cell wall. So that is the feature of diagnose between, how can you diagnose between a North American blastomycosis and South American blastomycosis, mainly in the appearance of the organism. So that is the few areas we can ask question in blastomycosis. One another fungal infection is your histoplasmosis. Histoplasmosis. Now, this histoplasmosis is a capsulated fungal infection. Okay, they are capsulated, and that is caused by a fungus called caused by histoplasma capsulatum. Okay, histoplasma capsulatum, and there's an interesting feature of this histoplasmosis. Okay, the histoplasmosis mainly affect your liver, that cause your hepatosplenomegaly means the the organism usually affect your reticuloendothelial system. Affect mainly your reticuloendothelial reticuloendothelial system means your liver, spleen, your bone marrow, okay, lymph nodes. Okay, what are the reticuloendothelial system that is related to your reticuloendothelial system are your liver, spleen, bone marrow, okay, your lymph nodes, etc. So that is affected. That is called hepatosplenomegaly can be seen. So as it affects the reticuloendothelial system, it affects your liver, your spleen, your blood. Okay, you are very what you are affecting your favorite areas. It is called darling disease. Darling disease, okay, because this is usually affecting your reticular endothelial system. So that is an easy way to remember. Histoplasmosis is called Darling's disease. Okay, and what else you can see in this histoplasmosis is that the lesions of the histoplasmosis, they cause ulcerations, and ulceration resemble a squamous cell carcinoma. Okay, so histoplasmosis is a fungal infection and that can resemble a squamous cell carcinoma. Now coming to the most important part, your candidiasis. Candidiasis. Okay, candidiasis. Candidiasis, you are seeing this candidiasis from your first year class itself, in your microbiology, in your oral pathology, everywhere you can see this candidiasis. Candidiasis is nothing but it is a yeast-like fungus. It's an yeast-like fungus that usually is a commensal in the oral cavity. It is normally present in the oral cavity. But when certain condition comes, okay, when there is a favorable environment for this fungus to grow, they will grow in the oral cavity and they will invade the epithelium and can cause fungal infection. That is called candidiasis, or we say moniliasis, or called thrush, oral thrush. Okay, so it is a yeast-like fungus. It can exist in three forms. Okay, so the candida can actually exist in three forms. One is pseudo hyphae, there is yeast form, and your chlamydospore. Okay, so these are the three forms candida can stay. And what is the organism, or the name of the organism? The organism is called mainly your candida albicans. There is lot many in the family, Candida paracilopsis, Candida krusei, Candida albicans. Okay, so main one is your Candida albicans. So it is there's a question which is the most common, opportunistic fungal infection. This is the very famous question which they ask in your competitive examination. The most common opportunistic infection. Okay, so most common opportunistic infection is your candida. Okay, candida infection. So whenever there is a condition for this to grow, whenever there is a chance, whenever there is an immunocompromised state, okay, so what happens, whenever our immunity goes less, the candida will grow and they will penetrate the epithelium. So yeah, simply seeing a candida in the oral cavity doesn't mean that we have candidiasis. Okay, when it penetrate your oral epithelium and make some infection, then only we can say we have candidial infection. Now candida can be classified. Okay, candidal infection can be classified into your primary infection and your secondary candidal infection. Okay, the primary infection and the secondary candida infection. Primary infection, that is infection which affect your oral cavity or in the localized area, and secondary infection, that is infection which is due to systemic disease, systemic candidiasis. There is systemic candidiasis. Because of the systemic candidiasis, you are getting some kind of oral manifestations. Now in the primary, it can be classified into acute and chronic. In the acute, it is again subdivided into acute pseudomembranous and acute erythematous. Pseudomembranous and there is erythematous. And chronic also we can subclassify into pseudomembranous, chronic erythematous, and there is a few other in chronic, that is chronic hyperplastic, chronic plaque like, chronic nodular. Okay, so all these are your a brief classification of your candida infection. It can be acute pseudomembranous or acute erythematous, chronic pseudomembranous or chronic erythematous, and chronic hyperplastic can be also seen. And there is one another entirely different entity, that is candida associated lesions. Candida associated lesions means these lesions are seen in relation to the candida. What are the candida associated lesions? Please note this, because this is median rhomboid glossitis. Your median rhomboid glossitis, your angular cheilitis, your denture stomatitis. Okay, all these are your candida associated lesions. So this is a brief classification of your candida lesions. Okay, candidiasis can be divided into your primary candidiasis, your secondary candidiasis, and primary candidiasis can be divided according to the into your acute or chronic candidiasis, or it can be classified into your candida associated lesions. Okay, now let's see what are the important questions they can ask from each. Let's see your pseudomembranous candidiasis. The pseudomembranous candidiasis is also called your thrush. Okay, the pseudomembranous candidiasis, it's called your thrush. It is your chronic form, your chronic pseudomembranous candidiasis, and the appearance is like a thick cheesy material. Okay, thick cheesy white material. So how that will it appear? Hmm? And that material will look like a cottage cheese appearance. Okay, cottage cheese, or we say curdled milk appearance. Okay, curdled milk, like it means it's like a curdled milk or cottage cheese appearance, thick white area of white patchy area in the oral cavity, that is pseudomembranous candidiasis. Now there comes the question. Okay, which is the most common type of candidiasis? Okay, asis in immunosuppressed condition. Immunosuppressed condition. So this was a previously asked question. Okay, in your need, which is the most common type? You know, candidiasis is an opportunistic infection. Out of this candidiasis, which comes in them, which is the most common type we can see in the immunocompromised condition, your HIV or your AIDS or your steroid therapies. Okay, so mostly in this condition, when your immunity comes low, it is nothing but your pseudomembranous. Okay, your pseudomembranous type. Now coming to the erythematous type. Erythematous type. This erythematous type of candidiasis are usually a painful, and it is also called antibiotic sore mouth. Antibiotic sore mouth, because this is happening due to the excessive use of your antibiotics. Okay, so this erythematous candidiasis will look like, they won't look like a white patchy area, they will look red. They will look red in color, or erythematous. Okay, depapillated means there is loss of epithelium. We can see depapillation of tongue. Your tongue will be depapillated, and it is called antibiotic sore mouth, because why? Because it is mainly used caused by the use of your broad spectrum antibiotics, your corticosteroids. Okay, so the tongue, the oral cavity will appear red and erythematous. It is not white curly cheese appearance, it is totally the opposite. We have atrophy of the oral mucosa, we have atrophy of the tongue papillae. Okay, and that is looking very painful. Okay, this is also very painful. So this is about erythematous candidiasis. Now there is another type, that is your chronic hyperplastic candidiasis. Now what is the speciality of this chronic hyperplastic candidiasis? It is also called candidal leukoplakia. Candidal leukoplakia. Now, what is the peculiarity of this candidal leukoplakia is that this is little firm. Okay, it is little firm, and it has a potential for malignant change. Okay, so it is considered a potentially malignant disorder. So which among the following is a candidiasis with a malignant potential? Which among the following is considered as a potentially malignant disorder? You should know that the chronic hyperplastic candidiasis, it has a malignant potential. It is considered as a malignancy. Okay, so that is all about your candidiasis. But the takeaway message, take home message is that you should have a thorough idea. You should read more in about the candida in the chapters, because that is the main focus area. At least from the fungal infection chapter, the candida is the most question area for your NEET and your INACT examination. So that area you should be thorough about. Okay, now there is certain question they can ask from your mucor. As mucor, it's a black fungus. Now, black fungus that is gained popularity in your COVID era, right? So many person having black fungus because of the unjudicious use of the steroids. Okay, the patient immunity or the person's immunity goes down and he is getting a black fungus. Actually, this mucor is a normal inhabitant in your nasal passage. Okay, in your nasal cavity, in the nasal cavity here, it's a normal inhabitant. So, but it is an opportunistic infection. So, when the immunity is gone low, when the patient is getting COVID, he is given a high dose of steroids, so his immunity actually goes down. So, in case of AIDS, is having any high immunosuppressive therapy, okay, there is chance of getting mucor. So, it is an opportunistic infection. It's also opportunistic. Now, if you see the clinical features of this mucormycosis, okay, you can see that okay, there are two types. There is superficial and yes, there is visceral. Now, the superficial mucormycosis usually occurs on your fingernails and skin. Okay, that doesn't matter. Now, the visceral mucormycosis, there are three types of visceral mucormycosis, and the one which they have usually asked as a question is that what are the three types which is pertaining to the nasal cavity? Okay, so one is pulmonary, and one is gastrointestinal, and this rhinocerebral. Now, rhinocerebral variant of the mucor is affecting your nasal mucosa and your sinus, paranasal sinus. It can affect your pharynx, it can affect your palate, and it can even affect your orbit, and it can even spread to the brain. Okay, so the rhinocerebral variant of your mucormycosis is the one affecting your nasal cavity. It can spread to the nasal mucosa, the sinus, the palate, and it can spread to the pharynx and the oral cavity, or in the orbit and the brain. And what you see here, you see a black in the clinical feature. You can see a black area of nasal septum. Okay, okay, there is black area in the nasal septum, so it appears black. Okay, that's why it is called black fungus. That's why it is called black fungus. It is nothing but they will necrose the nasal septum. There is necrosis. Okay, necrosis of the nasal septum. That is what you see. Now, the main question they ask from this mucor is that we have to see how a mucor appears in the histopathology. So, in the histopathology, what happens here is that we have a mucor, and the mucor, how it appear in the pathology. Okay, so mucor is having a septate hyphae. Okay, we say septate, no septation. It is not divided. Septate hyphae with a branching of this hyphae in 90 degrees, or we say obtuse angle obtuse angle branching. You can see here when the hyphae branches in an obtuse angle. So this is a major question area, the mucor, and which it is compared with a fungus called aspergillus. So there is other fungus which also affect the oral cavity and your nasal septum, nasal areas, nasal and oral cavities. It's aspergillus. Okay, that's another fungus. Now, what's the main difference between aspergillus is that aspergillus is also a fungus which is branch in acute angle. The branching of this aspergillus will be in an acute angle. Okay, so that is the main difference you can see in the histology of your aspergillus plus your mucor. Okay, so there is also in aspergillus the hyphae will be septate. Okay, there is a septate hyphae. So this is the main difference between aspergillus and mucor, and this is a very important question area. Please note. Okay, so these are all about your fungal infections. Nothing much more to ask in these fungal infections. You should be concentrating more on your more question area, the focus area. High yield questions are there in the candidiasis. Okay, that's about the fungal infections of oral cavity. See you in the next video with a different topic.